Good morning. This is Dr. McDaniel at GYN Corner. Sorry, I'm having some arm pain this morning, so thankfully it's Friday. Hopefully I'll be able to rest my arm a bit. I broke my upper arm, right below the shoulder, so I actually broke the upper arm and the ball of the shoulder, so the humerus and the tuberosity of the humerus has a big crack in it, big fracture, and then I found out I tore the anterior labrum of my shoulder, so the ligament that kind of sucks or pulls or attaches the ball to the cup of your shoulder, that has a big rip in it also. So I've been in pain for about a month. Goes in and out of being a big deal to a medium deal. So this morning, for some reason, it's painful, hard to move, so I might be wincing a bit when I talk today. But thank you for joining me. This is Dr. McDaniel, Facebook Live, and also check us out on YouTube at GYN Corner also. If you're in the tri-state area, please feel free to come on by. The website's midtowngyn.com. That's because I'm a gynecologist. I'm in Midtown Manhattan, right around the corner from Macy's and from Penn Station on 35th Street between 7th and 8th. We have appointments Monday through Friday, and we do walk-ins every day. Just call the office for the walk-in hours. I see walk-ins every day for urgent problems. You don't need to go to urgent care where they may or may not be able to totally help you. For GYN issues, you can come on over. We see for urgent issues, infections. Apropos, I see women every day as walk-ins for a bladder infection, cystitis, UTI. I spoke about cystitis yesterday, and I'm going to continue it today. Cystitis is the medical term for an infection of the bladder. UTI is a generic term for a urinary tract infection, so an infection anywhere in the urinary system. As I stated yesterday, everyone gets bacteria rubbed into the urethra, and it can potentially climb into the bladder, cause an infection. The bladder should be sterile. It should not have any bacteria at all in it. So theoretically, one can drink urine if one is desperate. If there's been an apocalypse and there isn't any groundwater that hasn't been radiated, you can gather up everyone's urine and everyone can share the urine for hydration. Yay, stay alive. So if bacteria gets into the urethra, it does have the possibility, and given the right circumstances, the most highly probable scenario is that it will climb into the bladder and cause an infection. Activities that increase bacteria in the urethra is any kind of daily activity. So exercising, especially if you're on a cycle, bicycle, exercycle, thong underwear, tight-fitting jeans, swimsuits, so any kind of increased friction activity. Obviously intercourse, I think a lot of people know intercourse can potentially cause a bladder infection. Regardless of what the environmental circumstances are, you can prevent an infection if you stay well hydrated. If you stay well hydrated and you urinate when your body tells you that your bladder is full, you need to urinate. If you hold your urine regularly, you can't get to the restroom, or you are too busy, don't want to waste time running to the restroom, you're holding your urine half the day, then holding the urine will allow for the urine to be stagnant and bacteria will be able to grow. You'll get an infection. The most common signs and symptoms of a bladder infection are, and these are the questions that I ask the patients when they come in, just to tick it off. You don't have to have a lot of symptoms. You can have a little bit. It doesn't have to be frequent. It needs to just be at least one time, because obviously one time it's not normal. So the most usual symptoms are waking up at night to urinate when you usually do not, feeling like you have to urinate, your bladder's full, and it turns out it's not actually full. Urinating more frequently than usual, or at least feeling like you have to go to urinate more frequently than usual. When you start to urinate, it feels like your urine doesn't flow as soon as your mind is telling it to flow. You have to wait a second or two. There's a bit of a pause before your bladder catches up with what your mind is telling it to do. When you finish urinating, feeling like there's still urine in the bladder, it just doesn't want to come out, or you have to force the urine out to feel comfortable that your bladder is actually empty. Either during urination or as soon as you finish urinating, feeling any kind of unusual abdominal pelvic sensation. So burning, pressure, ache, cramping, discomfort, or a heaviness. Back pain when you don't normally have back pain. Either lower back pain, so the small of your back, or upper back pain around the rib cage. Not normal. Even if you're not urinating, if there's any kind of general discomfort, ache, pressure, burning, heaviness in the lower abdomen, pelvic area, that's not normal. Blood in the urine or pink on the toilet paper. The urine being really dark, like dark lemonade, not clear as water, or pale lemonade. The urine having a bad odor, and being sure it's the urine. So if you're just changing underwear, there's a bad odor, that's a genital vaginal odor. If it's only when you urinate, then the urine has a bad odor. And if the urine has a bad odor, it's predominantly because it's concentrated with bacteria, and bacteria causes a bad odor. Anything that smells bad, it's due to bacteria. And especially if you have fever, chills, nausea, or vomiting. So those are all signs and symptoms of an infection, usually an infection of the bladder, so a cystitis, a bladder infection, but potentially anywhere in the urinary tract, so a UTI. And if you have those signs or symptoms, you can potentially address it on your own, or you can see a physician to have it medically addressed. I'll go into those details tomorrow. Thank you for watching. This is Dr. McDaniel at GYN Corner on cystitis, bladder infection, UTI, urinary tract infection. Have a great rest of the day, and please check out the YouTube channel. It's also called GYN Corner. Like, subscribe, comment. Please ask any questions, any topics you'd like for me to address here or on the YouTube. Please just post them and I'll be happy to address them. This is GYN Corner, all things health related for women. Have a great Friday, and I'll be back tomorrow. Tomorrow's the horse farm. Bye.